All right, we'll go ahead and get started. Happy December and happy holidays, everybody. We have a rather short agenda for MCTTD today, so we'll dive right in and then get you passed off over to the Inhale team. So our agenda for today looks like this. We'll talk about the final reminder on our extra credit opportunity, the performance measure reports that went live last week, and the CGM coverage loss survey, one last plea for help getting patient responses from that. The dashboard updates that'll be going into place this week as well, the tentative and some of the currently scheduled learning community events that we have planned for 2026. Quick reminder to submit that clinical champions meeting information, and then PO small group discussions update. So with that, we'll dive in. So just as a final reminder, if you do want to take advantage of the opportunity to earn the 5 extra credit points for the scorecard, that is that physician and practice level VBR, learning community VBR, have to be completed by 1/1/2026. As a reminder, those points are intended to increase your score up to 100. Going over 100 does not increase the amount of VBR that you earn, but it is a way to supplement something if you missed a different points opportunity. All right. So performance reports did go out last week. You do have access to these through the admin portal now. So sample report here on the right just has a quick overview of what a practice level report looks like. These are available for primary care, endo, and nephrology practices. If you are a PO level user, you can access your physician organization's overarching summary report as well as all of the individual practices under the button on the left-hand sidebar menu titled MCTTD Performance Reports. If you are a practice level user, you can access your practice specific report for each of the performance measures that your practice is in. For example, if you're a primary care practice and you're in both the A1C and the UHCR measure, you'll see both of those reports under the button titled MCTTD Practice Performance Reports, also on that left-hand sidebar menu. POs, like say, can view their entire PO summary and the individuals. Practice reports and practices with admin portal access can view their practice reports. If you have practices in your PO that do not have admin portal access, please make sure to download those practice reports and share them with those practices. We did not email them directly to practices that don't have admin portal access. We are relying on you to help disseminate those if those practices do not have admin portal access. Please do know also that there is an appendix available through that report. This helps detail all of the specifics on that report. It defines the different metrics, talks about the different tables, and all of the data or the details of the individual measures. So please make sure to look for that as well. All right. This is just a quick overview of the practice reports here as well. So we have the UACR for both primary and nephrology practices, as well as the CGM interpretation reports for the endocrinology practices. As a reminder, these are process measures, excuse me. Early performance is expected to be low. This is for a specific period of time for testing. So by definition, every practice starts at 0 at the beginning of that time period. It is expected that you'll be below your baseline rate and well below your target rate. It is meant to improve over time. You have plenty of additional time. We're still very early in the performance period, so don't panic when you see that low target or that low rate. It is a process measure, not an outcome measure. For HEDIS, for the A1C targets, we are still waiting on the revised targets from NCQA. We will share those immediately once we get them. We anticipate that this is being affected by the previous government shutdown. So like I say, we'll share those with you as soon as possible. If there is large changes, we recognize that this has been a large waiting period. We will make adjustments if needed if there are significant changes. To be clear, we do not anticipate significant changes in the target rates compared to last year. But if there are, we will adjust accordingly. For additional reporting timelines here, current reports that were just sent out last week or shared through the admin portal cover time period up until August 31st of this year. That's the data period. We'll be sharing additional reports next up in March. That will include data through the end of November 30th. And we are having additional data release dates throughout the year, which will all be published and available on the patient data dashboards. So just a couple quick next steps. If you have not accessed those reports, please make sure to do so. And remember to share those with practices that don't have access. And then if you do have practices that don't have access and want to get access, you can always request those access. And if you want to review which practices have access to the admin portal, you can look at that under users if you are a PO level user. All right, so we are going to be distributing a PR, a performance report feedback survey. We want to know what you like, what you don't like, what could be done differently, how could we improve these progress reports. And so please do look out for that. We'll be distributing that end of this week, early next week. We are asking for both PO and practices to fill this out. If you would like to take a moment to let us know your thoughts, that would be incredibly helpful for us. We will iterate these reports between now and the next reports in March. So this is your opportunity to provide us the feedback about what you would like to see on the next reports. This also, for physicians, completion of this survey will meet the physician level learning community event. Quick important note there, community requirement event. All right, so next topic here is the coverage loss survey. So we had planned to end this at the end of this week. We are extending it through the end of the month. Quick plea, please make sure to tell your practices about this. There isn't really like any incentive to this besides that this helps us advocate with outside partners for better CGM coverage, to show patient testimonials, to show vignettes of real people as to how CGMs have made a difference in their lives and how losing coverage for CGMs also makes a difference in their lives. And so, like I said, there isn't really any credit or financial compensation to this, but this is what enables MCTTD to do some of the work that we do behind the scenes to help advocate for better coverage, to show and demonstrate efficacy of CGM, and provide those real world testimonials. So as a reminder, please help us gather responses to this from patients that have used or use CGM and are not on insulin. Thanks. All right, so as with the performance measure progress reports, we are also updating the visualizations on the patient data dashboard summary measures page. This is a slightly delayed. I know that we've kind of mentioned this a few times now. Had to make some tweaks to some of the coding that was not functioning quite properly. So the new release date is the end of this week. Everything's looking great. We should be right on target. And so this will be available through that summary measures page on the dashboard 2.0 side of the dashboard. If you do go into that currently, right this second, you'll still see at the top of the page HbA1c performance measure. That is referring to last year's, and so it won't track perfectly. When this updates, you'll see, and I have a couple of slides here, you'll see the differences on that. So basically what I want to make sure is clear to you is when you go to the dashboard 2.0 and click on summary measures page currently, it's not the current A1C performance. It will be, however, once this updates, and you'll notice the difference. And so if you're looking at it right now and notice that it doesn't track the performance reports that you just received, that's why. It will update within the week. All right. The other quick note on this is that the progress reports that we shared out with you, as I mentioned a couple of slides ago, they go back here, have data through the end of August of this year. This dashboard refresh and release of the performance reports on the summary measures page will have data with an extra 2 months. So that'll go through October 31st. And so performance on the progress reports that you received and performance on the dashboard won't match perfectly because the dashboard is more up to date. And so just a quick note on that. All right, learning community event topics for 2026. So shifting gears here, we are in the process of scheduling and confirming all of our 2026 learning community events. We're really excited about some of the topics that we have here. So these are the 5 that we currently have scheduled with specific dates for. So these include MASL guidelines for folks with type 2 diabetes, updates to the ADA standard of care, myths and facts about low-carb diets, gestational diabetes. So that's kind of a follow-up from the last session that we did for 2025 on type 2 diabetes and pregnancy. This will now specifically be on gestational diabetes and will be also led by Dr. Jen Wyckoff. And then finally, an overview of diabetes self-management, education, and support. So you'll notice here that these have specific dates. And then we have additional sessions that we are currently working on scheduling. So these 5 sessions are the ones that we're in the process of nailing down dates for. So these include a stepwise approach to low-carb diet counseling, new obesity and diabetes medications, mental health and diabetes distress scales and counseling, cardiac rehab and diabetes management, and new obesity guidelines, a case-based approach. So really excited about these. We hope that you'll join us and come to these in 2026 as well. All right. And then quick reminder here for the Clinical Champions meeting, one of the PO scorecard requirements this year is to host a meeting with your clinical champions as a PO that's part of your PO scorecard. Excuse me. For you to host that meeting with your practices that are participating in MCTTD. So just a couple of quick notes here. The changes that your practices are incorporating to meet these measures is a great topic for those, and the support that your PO and MCTT can provide to those practices, and as well as to go over the different and various MCTTD requirements in upcoming events with those practices to make sure that they have those on their calendars. In order to receive credit for hosting that meeting as the PO, all you need to do is to send us an email to the coordinating center with the date and time and the meeting agenda for the meeting that you hosted with your practices. January would be a great time to get these meetings set up and have initial progress reports. Since the initial progress reports have been established and sent out, you'll be able to review their progress with them at this meeting as well. So just a thought there. All right, so last topic here is our PO small group discussions. As we have in the past, MCTTD will be hosting PO small group discussions in the February-March timeframe. We have conducted these in the past, and we do these in lieu of the PO one-on-one calls that we did in the beginning of the collaborative a couple of years ago. POs reported that these were helpful, had a little bit more opportunity for peer-to-peer support and collaboration rather than just with the MCTTD Coordinating Center. We'll be organizing with your partnership and trying to put like POs with like POs so that you have similar characteristics to the other physician organizations with which you are on small group calls with. Specific topics are to be determined, but are likely to include things around practice support, increasing urine albumin creatinine ratio testing, engaging clinical champions at practices, and so on and so forth. We also will be asking you all as we're reaching out to schedule these for topics for your individual small group sessions. So keep an eye out for that. All right. With that, that is all we had. I will pause now for any questions, comments, concerns, and our January dates are here on your screen.